Good evening. We're here this evening to discuss an HIV vaccine trial. With me tonight is Tom Gibson, the co-chair of the HIV Vaccine Trials Network Community Advisory Board. The HVTN is funded by the National Institutes of Health and is a global vaccine program. We also have an HIV vaccine trial participant, Kenneth Peterson, and we have Deirdre Maloney, the Executive Director of Colorado AIDS Project, the oldest and largest nonprofit community-based AIDS service and education provider in the state. The mission of Colorado AIDS Project is to improve the lives of those affected by HIV and AIDS and to prevent the spread of HIV infection. Thank you so much for being with me tonight, and welcome.
Thank you for having us.
So we're here to discuss a new HIV vaccine trial. And why don't we just first discuss sort of the history of vaccine trials, and I think, Tom, you would be best able to address that.
Sure. As you know, to come up with a successful vaccine to fight any disease is difficult. And what makes it even more difficult is HIV. We're still learning about HIV and how it affects the body. So the government, after it discovered what HIV even is in the early 80s, did start the process of trying to find a vaccine to prevent HIV infection. As early as the early 90s, there have been various studies funded by the National Institutes of Health through programs called the HivNet and the AVAG, now called the HIV Vaccine Trials Network. And those studies started out, like with any study, typically is in animal models. There have been several different vaccines that have been studied over the past, well, since the early 90s. And those vaccines, really, one has progressed to phase 3 study, and that was found not to be successful. The current vaccine that we're looking at is in a phase 2 vaccine study. What that essentially means is before you even get into human studies, you start out with an animal study. We've now gone beyond that, and we've had a phase 1 study. Phase 1 studies are with very small groups of individuals, and they're just to see if the vaccine is safe. If it's proven to be safe, then we go on to a phase 2 study, which is to determine whether a vaccine is safe, but also whether it produces an immune response. We're now in that phase 2 study right now with the current vaccine study that's going on in Denver.
And this vaccine, it's sort of overseen by the National Institute of Health?
Sure.
And here how is it administered locally here in Colorado?
Sure. With the vaccine studies, we like to think of them as a partnership between the community. You can't have a successful vaccine trial without involving the community. The government, in this case the National Institutes of Health, which is funding a large portion of this study. And then the other part of the team is the vaccine manufacturer. In this case, it's Merck. Denver is not necessarily affiliated with the National Institutes of Health, but we do have in Denver the Prevention Center, which is cooperating with Merck to put on the study along with the Denver community.
And that's the Colorado Prevention Center?
Colorado Prevention Center, correct.
And Ken, how did you get involved with this HIV vaccine trial?
Well, I initially stumbled upon the Step Study website back in early January and looked for the closest facility where they were doing the testing. And it turned out to be Chicago, which they were only accepting female participants at that time. So I kind of gave up on it, and then I ended up moving here to Denver in later January, then got back on the website and checked out where they're doing it here in Denver, and called the Colorado Prevention Center and gave them they actually did a brief interview with me, and then I went in the next day and got set up with an appointment, and they went from there.
So we probably should be clear that this vaccine trial study is for HIV-negative individuals.
That is correct.
You do need to currently be HIV-negative.
Yes.
And how constraining are they as far as your ongoing practices, your sexual practices and stuff like that? Do they have a lot of constraints and guidelines?
No, not really. They pretty much tell us to act and live our lives how we normally would, but they do advocate the use of protection and safe sex, definitely.
Are there any anticipated side effects to this vaccine that you're under the trial study for, or have they told you about any anticipated side effects?
Well, I looked through a list of the side effects, and it was like a mile long, but I think with the side effects, they have to put almost everything in there, from a minor headache, if somebody else in the earlier study got a headache or something like that. So really there wasn't much in the way of severe, what do you say,
so you're not really
effects,
anticipating any particular side effects to the trial?
No, not at all. And so far I've yet to have any.
So how long is the study expected to go on? How long are you a participant?
I believe it lasts about 4 years. Is that about the time?
4 years?
5 years.
5 years. Okay, I'm off by 1.
Duration.
Yeah, so...
So what do they hope to, at the end of this 5-year trial study, what is it that they're, Tom, maybe you can answer this, what is it they are actually expecting to develop out of this? A vaccine to prevent HIV infection in the first place?
That's correct. What all these studies are hoping for is a successful vaccine that would prevent HIV infection. And a successful vaccine may or may not be 100% effective. In other words, someone who receives a vaccine might produce an immune response that will give them some protection, whether it's protection all the time or whether it works in some people but not others. We don't know. And as is the case with most vaccines for any disease, they're not 100% effective.
So safe sex practices are still an important part of anything to go along with this vaccine.
Definitely, and Deirdre might have some more comments on that.
We should maybe talk about how a successful trial, and if this did become successful and prevent people from being infected with HIV, how would that impact the currently infected population and things like that? And Deirdre, you would be better able to address that.
Sure. I think that, of course, if the vaccine is proven to be successful, whatever that looks like, it'd be hopeful. It would be a wonderful new tool for our toolbox. But I think the important distinction that we need to make is that there's a difference between a vaccine and a cure, as Tom talked about, that this would help to curtail new HIV infections, hopefully, but that there'd still be 1 million people, more than 1 million people in the United States living with HIV or AIDS, and 40 million and more around the world living with HIV and AIDS, that we couldn't forget. So we would still need to band together as a community and as funders and as the government to make sure that those people were continuing to get their services. At the same time, really the best thing we have now, and even if this vaccine comes out, is going to be HIV prevention. We know how to keep this from spreading. We need to work with people around their behaviors to educate them how to do that. And that wouldn't stop once we heard that a vaccine might be coming out. Even if it was going to help to stem the tide of HIV infections, we'd still be talking to them about the behaviors because they can still get STDs as well. So we'd be wanting to make sure that we were out there talking about it as much as we ever were. And while it's hopeful, we also want to make sure we weren't giving people an excuse to not think about HIV or AIDS anymore.
Yeah, and that's sort of with a lot of the therapies that have been developed in the last few years to take care of people that are already infected. That appears to be what has happened is the general public sort of has become complacent, and they feel like HIV is now a chronically manageable disease. Yeah. And I think that's probably one of the biggest fears. As a 23-year HIV survivor myself, I know how important it is to be always vigilant about it, and just because your labs happen to be good this month doesn't mean that you start doing things that are unsafe. And this sense of complacency and that the invulnerability that people feel because there is a therapy out there, some medicines that do help with the already infected. That's why don't you discuss about how the trend has been sort of reversing lately in infections in general, just because of the therapies that are available?
Sure. I think one of the greatest misnomers of all time is the term drug cocktail, which came out in the mid-1990s with the dawn of the new meds. And they have been great for many people. But what they've also allowed people to do is let their guard down. And so what we've seen is an increase in the infection rate for the last few years. We're seeing 40,000 plus new infections in this country alone every year. And what we believe that's a result of is people thinking, oh, there's this cocktail out there that we can take. It's not a big deal anymore. Not something I need to be thinking about anymore. And so it's really, the meds have been great, but they have caused people to really let their guard down. Like I said, the other thing to keep in mind is that there's a limited number of medications out there. They don't work for everybody. HIV is an extremely smart virus which can adapt to medications in certain situations. and they come with very, very difficult side effects. As a matter of fact, at Colorado AIDS Project, we see people who choose not to take medical combinations because of those side effects and the way it affects their body. So absolutely, just like a vaccine, the meds have been a wonderful evolution for us, a wonderful tool in our toolbox, but we need to make sure that we're out there and being steadfast about getting prevention messages out there, as well as making sure we're going to continue to have services for people living with the disease.
Another thing that I'm sure that some of our viewers will maybe be concerned about is being a participant in this study and how that makes you perhaps vulnerable to the virus itself. Have they talked to you a little bit, Kenneth, about the safeguards of keeping you from becoming infected by the vaccine itself? I mean, what have they told you about that?
There is virtually no chance of becoming infected by the vaccine itself, because it does not contain a live HIV virus. As far as I understand, it has some of the, not DNA but proteins, is it? Included in basically a dead virus. And so there's no way that HIV can form from that or infect us at all.
Have they given you any statistics about how many participants they expect to eventually seroconvert, or any of the statistics about that? Because there will be a certain amount, in order for the trial to be successful, some people will have to seroconvert through their behavioral, through their own behavior. So have they given you any kind of an idea about what your own particular vulnerability is in that regard, or has that made you feel like it's a really safe trial to participate in? I mean, do you feel really comfortable about this?
I feel safe being in the trial, but getting infected with the virus, of course, that is a risk.
Yeah, it's a behavioral issue. So
yeah.
And if I can just comment on study safety. The FDA, Food and Drug Administration, does oversee all these trials, and there are certain measures that are in place to ensure the safety. And some things that are in place in this trial are, one, there's an informed consent process where people are informed of the benefits and risks associated with being a participant in the trial, as well as an oversight committee called an Institutional Review Board, or IRB. And most studies do have what's called a community advisory board, both at the local level and at the national level. So those are all safeguards to protect someone. And the Institutional Review Board especially is involved on a regular basis to determine whether there's any adverse events, whether they're serious or not, associated with the trial. And if there are any adverse events, like if there are a large number of breakthrough infections, the trial could potentially be shut down. So there are lots of safeguards in effect, and there's no way that there could be a HIV caused by this particular vaccine. So.
If there is a successful vaccine developed, do you think that's going to impact the government's response to the currently infected population? I mean, is there a danger of that, of the people that are currently infected sort of being shoved aside and less importance? Well,
I think a successful vaccine would certainly take up the headlines in the media, and rightfully so. And to be honest, right now we're constantly working with the government to make sure that they're still focusing on HIV and AIDS domestically. I think that HIV and AIDS overseas is clearly a pandemic, and it's getting a lot of focus, and we're actually right now doing what we can to make sure people remember that we have an issue domestically. And I think we would just make a concerted effort to continue those discussions with the government and really work with them and advocate around making sure that they were continuing to take care of people living with HIV and AIDS here and continuing to help fund prevention messages. It'd be very easy, not just for the government, but really for everybody to say, there's a vaccine out now, we don't have to worry about that. Mm-hmm. And I think HIV and AIDS is really something people don't want to worry about. And I think that's why we've seen that apathy happen.
Well, it's already happened with the therapies,
right,
and people surviving for longer. It's
right,
not an immediate problem, so the response is not nearly as an immediate response.
Right. So we need to make sure that we were doubling, tripling our efforts in making sure that we were getting the messages out there about what the vaccine is and is not. And we would make sure we did that.
Also, even though Colorado Outspoken is a gay and lesbian television show, we need to sort of address how how the face of AIDS itself has changed so drastically and how it is no longer a gay disease. And you can perhaps explain a little bit about the scope of how it's changed.
Certainly. The HIV virus does not discriminate, certainly. And the three populations we're seeing the sharpest increases in infection in the United States are women, teens, and communities of color. We're seeing people who are already disenfranchised in a number of ways, seeing sharp increases in HIV infection. So what we're doing is going out there and working with these populations to make sure that they know all about HIV. When we talk about HIV in the context of the gay community, it's been something the gay community has actually focused on in a large way since the 1980s. And what we're trying to do with the gay community is make sure that they understand it's still an issue. For a lot of the emerging communities, we're having to go out there and really talk to them about it. In a lot of cases, it's the first time they're having these discussions. And so we're just working with them in every way that we can to help them reduce their behaviors. Nobody sets out to get HIV. Nobody. And so it's different behaviors that lead to that for all kinds of reasons. And so we're going to make sure that we address those reasons as well as the HIV itself.
Well, the government's insistence, especially at the student level, on abstinence-only education, I think is that's a catastrophe. I mean, because it doesn't work, and people are not getting the information they need.
Well, I think the biggest issue around it right now is that HIV and AIDS is not part of the norm. It's not part of the dialogue that we're having on a day-to-day. HIV and AIDS is a healthcare disease, it's an access disease, it's a human rights issue, it's not a morality issue. And yet, in our country, in a lot of ways, it's being couched as a morality issue. It's being couched as a right and wrong, a good and bad. And what that does is really create a lot of barriers for people that would normally be able to go out and get information and get tested and learn about their prevention efforts. It's keeping them away, and it's keeping them from doing that. And until we can make it a healthcare issue again and make it part of our day-to-day dialogue, the challenge is always going to be there.
Yeah, the argument has become so politicized that there's no reasonable discussion any longer.
That's right.
People with extreme unreasonable viewpoints are the ones who are the policy decision makers in our current administration. So, yeah, things really need to change a lot in that area. Is there any resistance on a national level for the development of this vaccine, or do you see with the government agencies just total cooperation and hoping?
Of course there's never enough funding, especially in the current administration, for vaccines or for other types of prevention. Apart from vaccine, the National Institutes of Health is also looking at microbicides to help prevent HIV infection, perinatal types of interventions, behavioral interventions. So there's a whole host, but really to get a handle on this pandemic, especially from a global perspective, the only way to do that is through a successful vaccine. And in order to have a successful vaccine, we definitely need community participation and community involvement, not only as trial participants, but also as advocates for a vaccine.
So why don't we sort of wrap it up at that point? Are there any viewers out there who are seeing this discussion that are interested in this vaccine and would like to learn more about it? They should either contact the Colorado Outspoken website, or there's also the website that you initially became involved through, and that's www.stepstudies.org.
Yes, that is correct.
And they can find out anything more that they need to find out about the HIV vaccine study. Thank you so much for your participation in this discussion.
Thank you.
Thank you.
Thank you.
And good night.